understand that you guys would like to know about what out of community services we can look forward to in 2020. Okay, so essentially what the main focus is obviously going to be on is the governor's budget. The budget and the Medicaid reduction and deficit in regards to that. So on the local level, I've been working in anticipation of this with the contract leadership in regards to how this is going to impact their service delivery in 2020. Again, there's still a lot we don't know. The other thing that complicates their lives a little bit is they, all but one of them, have new fiscal staff. And again, when you're dealing with state agency funding, it's not something you typically go to school for. So I've been working with CCSI, which is a contract agency that monitors our state reporting for my office, who have many, many years of experience. And we've kind of put in some safeguards to monitor their spending in the service delivery lines, kind of tracking that a little bit more frequently, reviewing their invoicing, the billing for the services in certain service lines, just kind of keeping track of that sooner rather than later. Really focusing on the fact that we want to make sure that they are getting every eligible dollar that they're entitled to. And if not, why not? We've already talked a little bit about some staff training, connecting them with the regulatory agencies at the Albany level. A lot of times you just don't know who to call or what questions to ask, so prompting that kind of conversation. Let's see. A couple other big initiatives for the county is we are in the first year of the Columbia University Healing Community Study. That has to do with Lewis County being one of 16 other New York State counties in regards to studying the impact of opioid deaths and service delivery in Lewis County. Lewis County is in wave 1, so that we will participate in all 4 years of the study. And right now we are finalizing the steering committee, which will help guide the services within the county. We have our first meeting in January 28th. That is going to combine not only the local steering committee as well as the Columbia University staff, as well as the study staff itself. We've contracted with Fort Drum Regional Health Planning to provide the staffing, project management, so things are going well. We've been meeting with the Fort Drum Regional Health Planning pretty much on a weekly basis, just trying to make sure that we're understanding what's going on, what do we have to do when. Another big initiative is the community schools. That is a partnership with community-based organizations and school districts of Lewis County. We're going from the data gathering stage to the operational stage and essentially assessing the services that provide the county the needs of our population and how we can work better with schools. I think that's pretty much it, really what I've got folks for 2020. Does anybody have any questions?
The opioid deaths.
Mm-hmm.
Do you have any idea how many there were, like in 2000?
Yes. So since 2017, when we had that significant spike, we've trended down, and I see you got a pen in your hand. I will confirm this with you, but I want to say for 2019, I think I have the first 3 quarters from Leanne, and I want to say we're at 3, but don't quote me on that. I don't have all of 2020, and I'll just confirm that and send that all out to you all.
So 2017 was
huge.
Like 10?
It was 13.
It was 13 to 16.
Yeah.
Really?
Yes. And we've trended down since then, and I was able to track the deaths prior to 2017, and I keep tracking them since. I can send you all the updated ongoing report that breaks it down year by year. And essentially prior to 2017, we averaged 3 to 4. We had that spike, and then we kind of gone back to, I hate to use the word baseline, but saw some significant improvement on that.
What do you attribute that to?
The spike, unofficially, we attribute that to a bad batch of heroin.
It was on the first quarter.
It was the first quarter of that year. However, we didn't remain stagnant. I mean, obviously, as a result of that, both the mental health and substance abuse providers changed their referral processes, meaning that more open times for people to get help, getting in quicker, and getting referred quicker. OASIS also implemented some strategies at the state level, mandating the agencies to have different procedures for getting people in quicker. So I think there was a combination of things that assisted us, and we continue to do that.
And Pat, would you say that also the wider distribution of Narcan also has helped?
Oh, absolutely. Yeah, that would be one of the changes.
I do know that just from some cases where people were saved with Narcan.
What do you mean by wider distribution?
That people can actually go to some facilities or to some agencies and be trained on how to use it, and people who may have addicts in their family who
That's what I was
they're
wondering.
actually getting trained, and some of them are being given some of the Narcan kits.
So do they
That's
give
true.
those that are trained Narcan for free, or do you purchase?
When you participate in the training, they give you a kit right then and there to walk away with it. It costs you nothing. So there's different ways of accessing it for free versus you can absolutely go to a pharmacist and ask for it without a prescription. That I've identified, depending on where you go, there is a cost affiliated with that. There's also sites, these are both in Jefferson County, of where that you can walk in and say, I need a new one, and they will hand you a new one for free of charge. When I say we, Ashley Waite from Public Health and myself will be meeting with ACR Health, which is a provider of that, and to determine if we can have kind of a better access to that available other than Cradle Community Center, which is another facility you can walk into, ask to be trained, and they do have Narcan available.
If you go to the pharmacy, do you have to show them that you're trained? I assume.
That I do not.
I'm
think so.
trained, and yes, I had to show them the card that I had the
Okay.
training that allowed me to get the script.
All right, that makes sense.
But in my case, the script was billed to my insurance. I have no copay, but the script is billed to the county insurance.
So my to-dos I will follow up and give you the most current updated, and again, that's over time, the course of time, I wanna say I have numbers from 2013 on.
It's 3:13 right now, so you think you'll have that by 3:23?
No. No, but if I had my iPad, I might. But yes. Any other questions?
I would just add, Pat, that we did distribute amongst the board some thoughts about important issues in the community, and the highest response that every legislator, almost everyone agreed on, was that drug and alcohol addiction was a priority.
Okay.
So just to let you know, it's something that we're going to want to try to focus on.
That's right. I'm here to help. Thank you.
Thanks, Pat.
Hi, everybody.
Does everybody know Crystal now?
I think
It's been
so.
a couple months, right?
Yeah.
Phil, do you know Crystal?
Yep.
It's been a whole month, Ryan.
Has it been, how many months has it been?
Just one, but a whole one. So I put together this. Oh, I need a few more over there.
That's up to going back.
Sorry. Oh, sorry. I put together this handout to help us talk through our goals at Ups for the Aging for the next year. Some of them are very high level, very broad, and others are a bit more specific. So we'll just jump right in. So one of our main goals is to keep seniors and people with disabilities at home. And we mainly work to do that through our New York Connects program. So I'm still learning a lot about New York Connects. I'm learning that the services and the resources through New York Connects are much broader than I even knew before I came to OFA. And there's a lot of additional training and additional opportunities that the state's going to be providing in 2020 to help our New York Connects care coordinators, they're called, better resource people who meet with them to understand resources to keep their loved ones home. And I think it's important to remember that New York Connects is a fully state funded, is that how I say it? Funded fully by the state. so no county match with that program. And one of the main ways that I'm hoping to support our office with this goal is to continue to strengthen and improve our relationships with community partners. So the hospital, and other nonprofits in the community that provide a lot of resources and support to folks with needs at home. We need to make sure we're working closely with them. The next goal here, goal 2, is to ensure high quality of life for seniors and caregivers. We have several different funding streams that contribute towards this goal. And the whole idea is to keep not just keep people home, but maintain that high quality of life through supporting caregivers and making sure that folks are connected with all of the resources that they need to successfully be home. One of the main ways that we're going to work to do this is to enhance our education for folks on consumer-directed personal care. So you might be familiar with ISEP, our in-home caregiving services. One of the ways that we can provide that in-home caregiving to consumers at home is to connect them with this consumer-directed program where it's just as it sounds. They identify and hire their own caregiver, and then that person is paid through a separate entity instead of OFA contracting with US Care and managing all of that care. And then the aide doesn't show up and they don't do what you want them to do anyway. The whole idea behind consumer directed is I pick my aide and I supervise my aide, and that person is paid through a separate funding stream that just so happens to be a few dollars cheaper an hour.
And it could be a relative, a
Yeah.
neighbor, someone that's in the community that's a little more consistent than a US Care minimum wage,
Yeah.
person.
Your ISIP waiting list is
Mhm.
almost equal to the ones you're serving.
You got it. So, consumer-directed personal care can help with that waiting list, and there's some new funding opportunities that the state's going to be releasing in the next year that can also help us address that waiting
So in
list.
conjunction with trying to keep people in their homes,
Mhm.
that part of your solution is
To provide them care in the home that
provide
they
them
need
more
to be.
ISIP care or
Right.
We need,
from some form.
we need to pull that consumer-directed lever more in Lewis County because our vendor, US Care, and even the vendor that Jenny uses for
We use US
your
Care,
in-home
but we
use.
have 50% of our cases are consumer directed.
Okay, but the point is, US Care doesn't have the staffing to be able to fill on need. in Lewis County.
Evidently.
They don't pay mileage for their people when they pay minimum wage, and it's tough work. It's, personal care, and so they're not able to find the workforce that they need. So if we can try to direct more people towards the consumer directed, it might be a more consistent way to make sure that, a friend, a neighbor, a loved one can help out a little bit.
I think that is important.
It's very important. I think sometimes it's new and unknown, so our staff and families feel a little leery of it because there are a few hoops to jump through, but if it's explained to you and if you're guided through it, I think it's really doable.
Well, us old people don't like change.
That's true. That's true. I don't know anybody like that. I don't know about you, but our next to do under this goal is to increase our caregiver support services for folks with chronic illnesses and disabilities. So we have a great partnership with the Alzheimer's Association of Central New York, and a big goal of mine is to explore other funding opportunities to provide caregiver respite, keep people home and avoid caregiver burnout. So if you flip over to the next page on the back there, goal 3 is to get seniors moving and seek Medicare and Medicaid reimbursement for the county. So there's a big initiative in the state that I know you all have learned about and supported in the past around evidence-based programming. So we have the partnership with Double Play around our Walk with Ease programs, water aerobics, which I went to last week, and it is no joke. It got me going. And the thing that struck me about water aerobics was the socialization and all the smiles, and I think and that's the point of
Doesn't Brittany
evidence-based
teach?
programming. Brittany sure does.
Davis teaches.
She had great music playing, everybody was smiling and laughing, and as a social worker, I understand those emotional health benefits right? We need to not only keep people's bodies healthy, but keep their minds healthy, like we were just talking about. And our evidence-based programming does just that. There's lots of opportunity to expand that program. Once you go to one of these water aerobics classes, I walked away thinking we need to make sure this class is going 3 times a week, every week, the whole year. We need to grow this program because it's amazing. And we also need to work with the Medicaid long-term care insurance companies to create some new revenue for our office. I know you all have heard about this before, the opportunity for us to bill for home delivered meals for folks that have this Medicaid long-term care insurance. Once we master that at our office and we have some revenue coming in, we can then look to expand our meal delivery to folks who are under the age of 60. We're serving the community better and bringing some money in for what we're already doing.
So when you say Medicare long-term
Yep,
care,
Medicaid.
Medicaid, so it's a government program and not private insurance, long-term private insurance.
Right. There's also some opportunity through Medicare insurance plans, and I know a little bit less about this, I'm still learning, to bill for the evidence-based programming. So I think once I get my feet wet and our office gets our feet wet around how to work with insurance companies, other offices for the aging are really blossoming and exploring ways to bill insurance companies for services that we provide, because Medicare has many wellness initiatives that we could tap into. Next is to promote healthy relationships and work to end elder abuse. I'm looking for OFA to continue to partner with adult protective, legal services in the community, and advocacy services, mainly through Lewis County Opportunities, to do a better job supporting folks who are experiencing exploitation and abuse, but also, and in some ways I think more importantly, educate people of all ages around what abuse and exploitation looks like. Not every person, as we all know, experiencing abuse is going to be willing to prosecute. The best way that we can keep people safe is prevention, is to have folks be able to identify financial exploitation and cut that nephew who's abusing drugs and seeking money from their aunt off at the start, right? Make sense? Any questions about that?
How rampant is the elder abuse?
I think that that's tough to know.
Yeah.
I don't think adult protective is seeing huge numbers.
We get
but
somewhere
some.
between 70 and 100 referrals a year. The elder abuse incident survey from 2 years ago indicated we should multiply that by 4. So every one we know, there's 3 unknown.
Is it predominantly like financial, or is it both physical and financial?
It doesn't, if there's a reason someone comes into us, there's always financial problems. But sometimes they come to us with finance and nothing else.
Okay.
So finances are always part of that equation. Just, it's 100%.
Okay.
And I see this as a long-term goal, that we start educating now about abuse to prevent abuse that will happen 20 years from now, and to help folks now, but this is something we need to be always doing.
Like advertising, sending out pamphlets. all
Yeah,
this stuff.
community outreach, maybe getting information into doctors' offices, that sort of thing, yeah. The last goal, and I feel like this is particularly important for me as a new director, is to increase our business savvy. So we need to develop an understanding as human service professionals how to operate in a more cost-effective way and to tap into existing resources like we were talking about the Medicaid long-term care insurance policies. So New York State's offering great training and support for my team, and I will continue to participate in that, and I'm really looking forward to networking and working with other counties that are a little bit farther along than us and learning from them and having them mentor us.
We like revenues,
Right?
right?
Yeah, me too. Serve more people that way.
There you go.
Yeah. Any questions or anything you want to bring my attention to, have me focus on?
Thank you.
You're welcome.
Thank you, Chris.
You're welcome. You're welcome.
Cassandra?
Yes.
She-
For you.
Did you get the OFA one too? So,
Oh.
Yes, sorry.
All right, so what you have in front of you are our 2020 priorities. On the front are our strategic plan priorities that we set back in 2017 with our 5-year strategic plan. And on the back are some program-specific priorities. So I'll start on the front here. We have our 5 overarching priority areas: infrastructure, workforce development and leadership, strategic partnerships, research and data-driven performance, and lifelong health and well-being. So a big part of infrastructure is accreditation. That's kind of been put on the back burner for the past 2 years. So we've been doing things like the workforce development plan, the health communication and social marketing plan, doing larger plans, but haven't really gotten down into doing the actual self-assessment and figure out if we're ready to apply for accreditation. So this year is going to be the year where we sit down and do that self-assessment to see where we're at with that. I would also like to research electronic medical records and billing platforms to try to help some of our efficiencies and storage issues. We'll have a significant increase in our medical records with our lead case management cases going up. So this gives us more reason to look at an electronic medical record for that. Workforce development and leadership. We are going to start utilizing the State Health Department's learning management system to upload our annual trainings that we currently conduct at all staff meetings. That way staff can go on and do the trainings. We can track them. We also utilize this system to assess staff competency, and from that assessment it recommends trainings that they need to conduct. So that will be new for us this year. We had about 50% of our staff within the last year, 50% of our staff have been new to their role. So this year will be another year of training. We put a focus on cross-training because we have had openings throughout the year. With that much turnover, we do have openings. So it's been vital for somebody else in the office to know how to fill those shoes and perform those roles. So we will continue to focus on that this year to build competency. And also we utilize the county employee satisfaction survey. We get public health specific data. We look at that year over year, identify areas for improvement, and try to create an action plan to improve. Strategic partnerships. We are always looking for ways that public health could integrate into community planning and policy work. That is where we get the most bang for our buck. So anywhere that we can make the healthy decision the only decision, or the most logical decision for people, that's where we will have the biggest impact on health years down the road. Some of those specific initiatives we will be working on include Complete Streets, Zero Suicide, and the Comprehensive School Physical Activity Program. And those are part of our Community Health Improvement Plan. The next area, research and data-driven performance. I am very focused on improving the tracking of our local health impact of our evidence-based programs. So we know these programs work, they're evidence-based, the research is out there, but I want to show the local impact. So for instance, with DPP we're tracking pounds lost, but there's other health impacts that we're seeing locally, preventing readmissions and things like that. We need to track that in order to prove our value to payers, potentially, of these programs, and
to go along with that, I will also be working to implement our value-based payment work plan, and a lot of that is proving that value so that we can hopefully receive some revenue for these programs that we're currently providing under state aid funding. The last strategic priority area is the lifelong health and well-being. We will continue to work with community partners to increase referrals to evidence-based programs. We are looking to enter into an agreement with FDR HPO, and you have a resolution in front of you, they receive some grant funding to increase referrals to these programs because they do have such a health impact. So we will be working with them to do some marketing and strategizing around increasing those referrals over the next year. And also, Anna Platz became a certified health literacy master trainer this past year. Health literacy was part of our strategic plan, and she will be working with local health and human service agencies to improve their health literacy practices. I'll just hit a couple of the big ones on the back. Under children with special needs, we have a new EI documentation and billing system coming. That will be released by the state in July. That's going to be called EI Hub. So staff will be working to learn and transition into that system.
What is he?
Early intervention, sorry.
No, that's fine.
We will continue to track the increased lead poisoning prevention caseload and the associated cost and impact of that. We do have a county staging site drill. That's our emergency preparedness drill for this year, and that is February 18th at Lowville.
So what are we doing this year? We're talking about receiving inventory and distributing it back out and
Yes.
pretending.
So the last couple of years have been building upon next year will be our big exercise. So this year, we are focusing on receiving in antibiotics. It's an anthrax scenario. So we receive them in. We will be inventorying them through the state merit system and then pushing them out to our pod site, which we're holding this at Lowville, so it'll be right there. It's a perfect scenario for us to have our staging site and our pod site, so we just have to move it into the gym. However, the state wants us to actually utilize the transportation vehicles that we'd be using, so we're going to load it on trucks, drive it around the parking lot with the police escort because it needs to be secure at all times, and then drive it back into the building, and then it needs to come back to the staging site. It's just a piece of what we'll be doing.
$10 at work, driving empty boxes around the parking lot.
It's practice. You need to know if the pallets are gonna fit on the truck, and if you don't practice it, you don't know if it's not gonna work.
That's right.
How was that lead poisoning? Is it, I think they outlawed lead paint back in the 70s, which is 40 years ago. Is it decreased some? Is it holding its own? They found other places to get lead, or how's that work?
There's other places to get lead, but we have an old housing stock.
Right,
So
that's the other piece of it, yeah.
there's still lead paint in a lot of our housing stock.
And didn't they lower the percentage
They
of what
lowered it.
has to be found in your blood so that more people
Maybe
now
that
have to be
too, yeah.
treated, right?
Okay.
Yes,
Yeah.
they lowered it from 15 to 5.
Parts per million?
No, micrograms per deciliter.
This is a quiz.
What's micrograms to inches?
Oh, come on.
Just a second, we can find that out.
Yeah, so our lead cases are on the rise, and they will not plateau probably for a couple of years because these children stay on for some time, years, until they actually get below 5.
What do you do on social media? I saw you had a report that you had a whole bunch of hits or whatever you call it.
Yep. So we have a Facebook. We also have
You have a Facebook site?
Yes, we do. Lewis County Public Health.
They're very
the
active.
search for us. So the reason we have this is not only to try to encourage people to be healthy, but in the event of a disease outbreak or any other kind of emergency where we're ultimately responsible for their health and safety, we need to be able to reach people. So the more people that follow us, the better.
What kind, do you post things, various things, or
Oh yeah,
warnings or whatever, or?
a whole variety. We share other partners' events or things that they have going on, messages. The state aid, our state aid requires us to hit a bunch of health topics, so we utilize that to push out education.
So if something was relevant to our area, we could share that with our friends or whatever.
Yeah, we would
And
encourage
it
you
would be a
to
good
do
warning
that.
to them or
Yep,
whatever the case might be.
yep.
Do you have a rabies clinic?
Yes, we have a rabies clinic this Saturday at 10 o'clock. Any other questions?
I do share.
Thank you.
You're on Facebook.
Yeah.
Hi, everybody.
I
So, be quick, I didn't make a handout, so you'll have to pay attention to what I'm talking about today. But for 2020, so as Ashley talked about at Public Health, their high turnover, we also had a tremendous turnover at DSS due to multiple retirements. Some people had personal issues and left. Someone else went on for a higher degree, went to become a guidance counselor and went to a school, other things like that. So all this year, it's really about rebuilding our staff after these very long serving people retired from DSS, not only in the last year, but in the prior couple years. 2 weeks ago, I had a DSS breakfast where we outlined what we want to do for 2020 with all the staff. It was the first time since I've been commissioner I was able to stand up and say, I have no planned retirements for this year. That being said, we have many people that are eligible to retire, and they may choose to do so this year, and they may choose not to, but no one's mentioned anything yet. So based on that, one of the issues we're looking at is a nice intergenerational workforce. So we still have some baby boomers and millennials and Gen X's and one Gen Z right now. So we're working on that, and the employee engagement survey told us one of the issues to look at would be communication. So we're going to try to do that in a couple ways through newsletter articles. We do a monthly newsletter to our employees, but also through on-site training, which is that Potsdam contract that comes through here. So some on-site training with our staff on communication and the intergenerational workforce. So we're going to work on that. Other things to be looking at is in 2020, there are brand new emergency shelter rules out. So you know every time we talk about that day in street shelter, even though it's tiny, it's been considered an uncertified shelter because of its size. So the state has created small shelter regulations, and they are incredibly onerous, including medical evaluations of everybody admitted within 24 hours, on-site staffing, meals, childcare, and indeed they may be too onerous for us to continue. We're going to work with opportunities through that, and as the shelter provider, they do have a shelter worker on site 20 hours a week now for us. If you remember, we increased that contract to have a shelter worker. So she has started, and good news, she's a foster parent, so she's really familiar with DSS and people that are struggling in our community. The people going in the shelter, I want you to think about Pat's report, and she talked about the opioid epidemic. So it hits people that need treatment, but if they need treatment and they can't work, they're probably coming to DSS. So what are we doing with them? So a lot of review on that. We do have Credo on site 1 day a week in our office now, trying to entice people into treatment. And our step 2 of that is to try to create an MOU so I can take that counselor to go right out with our CPS and foster care staff. There's some steps in that process that we have to go through related to confidentiality, and Credo's primary concern is the safety of their counselor going out with child protection services. So there's some work to be done on that, but I think it's much needed. We get a lot of hotlines, pretty close to 500 a year, and there's a lot of drug use and activity that affects people's ability to parent. And if we can engage them into treatment instead of removing kids, instead of putting them with relatives, I think everybody will be far better. Which leads me to our Families First Prevention Act. So this is a federal act that's hitting New York State, requiring us to make sure we are placing children with kin, with relatives in foster care, not congregate care, and not just our regular old foster boarding homes. So that's the big push, is to look for kin. Lewis County has usually done very well with that. We currently have 15 kids in care. So let me give you an example. Thursday night, one of our workers is out, state police, kid barricaded, Joan probably knows the story, in the house. The child was removed but not placed in a foster home. The parent made a safety plan to go to a relative. We endorsed the second safety plan. The first one wasn't okay. And then that relative went and got custody Friday morning. Okay? Now we are going to continue to supervise that situation, but the kid's technically not in foster care. So that's kind of what we're talking about with Families First. Also, major reduction of congregate care use. We all know it's very difficult to have kids out of our area to maintain connections with their family. Also, it's very expensive for those that have to sit around the table and build budgets. So we haven't had anybody in congregate care in over a year, so we've been doing very well. That is likely due to the fact our children are all very young that are in foster care because of the opioid and drug use epidemic going on in our community. So the infants, positive tox babies, those kind of things, parents that just can't do it. So it's kind of a full circle thing when you talk about that, the drug abuse stuff. We're also looking, last year we approved DocuWare, which is an imaging system that we're putting up in our child support unit. So we just finally had our federal tax audit last week and in the building, and now we're able to move forward with full implementation of DocuWare. Once we get that moving in child support services, we'll move it to our child care unit, and then hopefully to adult services. SNAP, Medicaid, public assistance, they all have a state imaging solution. Those other programs don't, so we have to create our own. So we're doing that. We talked about the opiate epidemic and emergency shelter. I wanted to let you guys know that Thursday is the point in time count for homelessness. That is a across the nation date. Every community across the nation does this point in time count to determine how many people are homeless on that night. And the definition of homeless isn't couch surfing, it is they would be in a car, in a barn, in a place uninhabitable, and that counts. In New York State, what's happened, if you remember back in 2016, the governor created Code Blue, where we have to put everybody up, whether you're eligible for public assistance or not. So basically, our point in time count, we can count who's in that shelter under Code Blue. I think on the news, Jefferson County, you saw they're actually going to try to do some street outreach to see if people are in cars and things like that. But we'll share that data once it comes through for our continuum of care for Jeff Lewis and St. Lawrence County. That's the Points North Housing Coalition. Just to give you an example though, in 2019 we had 440 nights of stay at the shelter and 302 hotel nights of stay. So do we have homeless in Lewis County? We certainly do. And it's cold today, so Code Blue is in effect. It's not in effect if it goes over 32 degrees.
That's the trigger, 32.
The trigger's with the wind chill. I gotta log on to the very specific website for 32 degrees. So I gotta tell you, as you know, Crystal mentioned being a social worker, I'm only a caseworker, but when it's 35 degrees, and someone's cold in front of you, it's pretty hard to say, you're not eligible tonight. So
But
let's
if the
help
wind-
make
if the
another
wind's
plan.
blowing, they might be.
They might be if the wind's blowing in Loudville.
Yeah.
Cause that's where we picked is Loudville,
Oh,
so.
wow.
That continues to be a problem, cause Code Blue, you don't have to follow any of the rules for public assistance, and we still have to put you up. But if you're temporary assistance, you have to follow all the rules for us to put you up. So, it's usually people that are failing with public assistance, not going to treatment, walking out of detox. We had a guy walk out of detox over the weekend. So, then they're Code Blue until it's warm, you know, so, difficult population to work with.
Do you think that there's any of those people?
Code Blue, it varies and it changes, and some nights it's 0, many times it's 0, sometimes it's 2 or 3.
Oh, okay.
Sometimes we can re-engage them back into what they need to be doing, those kind of things. Find family.
How many homeless did you have last year?
I have the shelter nights in front of me, but I'll look up the numbers of people. I'm guessing, I'm trying to remember the log right there. Neighborhood of 50 to 60 different individuals.
But we didn't do a points time study last year, did we?
We do it every year.
Yeah, we do it every year.
Through Points North.
Gotcha.
Yep.
I don't remember.
Aren't there more homeless in Canada? Because aren't a lot of the people staying in camps, in the parks and stuff?
My own assessment, that has mitigated a little bit. So that's a vestige of, I thought I could camp in Whitaker Park for the whole summer, and then I wouldn't have to pay rent on my SSI check kind of thing. Whitaker charges now for you to stay. It varies why people are homeless. Sometimes it's because there's an addiction issue. Sometimes it's a mental illness issue. Sometimes it's a fire. We recently had a fire downtown. There was a family of 6 that became homeless, and a couple other people. So there's multiple reasons people can become homeless. So they come to DSS first, really, if they need emergency shelter, and then we work with our other community partners, like Snowbelt Housing and Lewis County Opportunities and Catholic Charities, to see if there's other options before we look at the shelter. Also on the morbid point, Pat talked about overdose and deaths. Our final numbers aren't quite in yet for 2019, but we'll probably go over budget on burials this year. We budgeted $60,000 for burials. We're probably up in the $65,000 to $67,000 range. We have this year. Huh?
2020?
For 19.
No, not yet.
19. We bury, I think the number's 35 individuals for funerals. I mean, before it was in the neighborhood of 17 to 18. So not all of those are drug related, and a large number of them are elderly.
That's a shot in the dark. If you look
It's
at
a
the
complete
last 5, you look at the last
throw
5
the dart,
years
I don't
number
know.
on that. We've had years where we spent less than 20 and years where we spent 81.
Yeah. So there is a smidge of reimbursement from the state for that. It is a Medicaid program, but it's not great reimbursement at all. So, we do continue to work with all our local funeral homes for that service. Any questions for Jenny?
Yes.
Of course.
You know me well, don't
Yeah.
you? Do you have a social media presence in particular in reference to Job Shop? Like,
Yes, we do. The One Stop, and it's managed by Cheryl Mayforth in Jefferson County, because we're an affiliate of the Jefferson County One Stop.
and that would show available positions for
Absolutely,
people?
and we share them prolifically through Facebook and Twitter.
So where is it on Facebook?
I think it's the Jeff Lewis One Stop. I have to look, I don't have maybe Ryan has it right there. Workforce Development Board,
It's the workplace.
the workplace, thank you.
I think that's what they call it on Facebook.
Yeah, it's what they call it on Facebook, the workplace.
The workplace?
The workplace.
That's the lady that's on television.
That's Cheryl from, Jefferson County. So,
You're right.
Yeah.
they also have other job listings. If you're registered at the One Stop, you can get email sent all the time that based on your profile of your work that will help you, because we can't post them all. If you walk in our office, you'll see lots of job openings, so they're all posted. Thanks, Ryan.
Well, the thing is to let people know about the job openings, you know?
Mm-hmm, yes. And Phil, you had a question about HEAP, where our numbers, including emergency, and yes, those numbers, so just as of this last Friday we've had 1,049 HEAP applications, that includes some emergencies, and we've pushed out $1,018,750 as of last Friday. And I have not heard if there's a second emergency yet.
For
From
this
what,
heating
from
season?
2019?
From November 12th
Till
of
now?
of 2019 till today.
1,049 people got $1 million.
$1,018,750. That's
And
1,049 applications. Some of those applications might have 6 or 7 in that household. Cause there's one application per household. Okay?
Yep.
So, that continues, usually there's a second emergency, I don't know if that's happening yet or not. If we don't have a second emergency, it stays cold, I would expect an increase in EAF applications, emergency aid applications. Just so, what door does it come out of? It's better to come out of heat, because that's federally funded. So,
Warming up Friday.
warming up Friday again, yep.
It's guaranteeing that.
It is, it's been a warmer winter, that's what makes me nervous that there won't be a second emergency.
I have a question with the aerials.
Yeah,
Didn't we set up a fee,
yes, we did,
and that's still good?
yes. We have not raised that amount
Okay.
in
And they all
6 years.
accept, all the, funeral homes accept that?
Yes, yep, they have all our local homes, even we just buried someone out of county, and they accepted that. There are things that sometimes add over and above, the transportation to pick somebody up, if we had someone that passed away at Strong Memorial in Rochester, so the funeral home went to Rochester and there. And then, I'm glad Ashley's here talking about wellness, a couple people have, exceeded the capacity of the casket, we had to upgrade to a bigger casket due to their weight, so that was an additional cost that was above, that's allowed in the contract, so. Some of those weird things that you would not usually think about.
Think about it.
Yeah.
Well, thank you.
Thanks.
So Steve couldn't make it today. He'll be back with his fourth quarter report next month. And then Penny couldn't make it either. So.
Move into the docket, please.
Resolution to appropriate $404.23 of grant funds into public health accounts for early intervention education material. We don't need motions, it's just all in favor.
Yeah, all in favor?
Yep.
Any opposed?
I'm opposed that we gotta do a resolution for $404.
We're gonna work on that next. When we get to this.
Yeah, that'll be okay.
Resolution to authorize an agreement with Fort Drum Regional Health Planning Organization and Lewis County Public Health to receive grant funds in the amount of $6,250 to participate on the grants action team and execute team deliverables for prevention and management of chronic disease in the community for the period of January 1st, 2020 through December 31st, 2020, and to appropriate the funds into the public health accounts.
Any questions? All in favor? Opposed?
Resolution to urge that the New York State Department of Health delay new lead poisoning regulations due to an unworkable timetable and an exorbitant cost.
Any discussion?
So, you think it's an unworkable timeline that they're asking for?
So a lot of counties are passing these resolutions. They didn't increase any funding when they dropped the
The
level
levels.
of action. And, I mean, our numbers are small, but we're still talking going from 4 to probably a couple years from now, 80 cases. So we're only a partial service county. Full service counties are not only doing the nursing piece of it, also environmental health, which is double the cost of what the nursing piece is. So they didn't increase any funding for it, so that's why.
Thank you.
All in favor?
Opposed?
Resolution urging New York State Department of Health and New York State Division of Budget to require providers to maximize reimbursement from all third-party payers for early intervention services.
Discussion? All in favor? Opposed?
Resolution urging the New York State Governor and Legislature to improve the early intervention program to better serve children and families through reforms to address the lack of available providers in many areas of the state.
Discussion? All in favor? Opposed?
Resolution to appropriate $11,500 of Medicaid funds into social services accounts for community first choice options.
Discussions on that?
What is that?
Jenny, you could probably explain it better than I can.
Yep, so this is a contract with Office for Aging for home delivered meals, like Crystal was talking about, additional revenue. Medicaid has decided that there should be more, a broader array of home care services available to people to keep them in the community. One of them would be home delivered meals. Another one would be same services, which is reintegration kind of counseling, moving, vehicle modifications, and home modifications all fall under community first choice options programs. And then a referral is made to DSS. We do assessments, find contractors, whatever. The easy one is home delivered meals, because our partners at OFA are already doing that, and so this is to appropriate funds for that.
That
It's all
doesn't seem to be a
Medicaid.
whole lot of money for everything that you said.
Well, it's not. We have no clue, and it's been delayed again. We don't know. They've delayed this three or four times, so it's delayed yet again.
So-
But we tried to take a stab at maybe what some home delivered meals would cost with this. It's all,
Well,
we'll
every
claim it
little
back
bit
and get it
helps.
back from Medicaid, so it'll just keep washing.
But I think the larger point here is when I
New
get done with
Medicaid
everything
services.
today, the governor will have released his budget today. I haven't had a chance to look at it yet. And there's a lot of talk, which he started in his State of the State, about walloping the counties with some of this Medicaid bill. This is not a federal mandate that-
No.
for Medicaid that we help seniors or, Medicaid eligible people adjust their cars or build ramps on their homes. It's nice, it's a great thing, but these are all New York State things. And the cost of Medicaid has gotten out of control. And now, the state, potentially this budget season, is gonna look to put more of that burden on the counties. So yes, it's a good thing that we're able to take some of that money, and sure, these are great programs, but these types of expansions of the use of Medicaid dollars are the reason why counties are in the position that we're in. So just to circle that back to the big picture of all of it, so.
And the other way to look at it is how much reimbursement do you get, for 25 cents for a
Right.
dollar. So you pay a quarter of it. So it's a hard call, but there's no doubt, I think there's gonna be a lot of budget problems this year.
Any more discussion? All in favor? Opposed?
Resolution to appropriate $25,000 of additional funding into social services accounts for TANF non-residential domestic violence services through Lewis County Opportunities.
Any discussion? All in favor? Opposed?
Resolution to appropriate $20,000 of Code Blue funding into social services accounts for safety net expenses from October 2019 through September 2020.
Discussion?
Is some of this money gonna be a maintaining fund and the rest of 2020?
It actually runs the time period October 1, because that's when the Code Blue period starts. So it's October 1, 2019. So, we had a few expenses. We had to wait till the plan was approved by the state, and then now we can do the claiming once we appropriate the revenue.
All in favor? Opposed?
Resolution to transfer $24,000 in the social services accounts to reallocate funds for WIOA.
Which is?
Workforce Investment and Opportunity Act, the workplace. So we're moving money from dislocated worker accounts to adult accounts in order to do some continuing education for some people.
Okay.
One more question? All in favor?
Yep.
Opposed?
Resolution to appropriate 30,000 of state funds into youth bureau accounts for Safe Harbor program.
Someone elaborate on that just a little bit for those that wanted the youth bureau meeting.
So Safe Harbor is a new state program, well, I don't know if the program is new, but the funding is new that is coming this year, $30,000 through the Youth Bureau. In future years, if the state continues with this funding, it'll run directly through DSS. This year, it's going to go, it's specifically for preventing human trafficking targeted at children specifically. It has to go, the requirements to spend the money are very specific, and in Lewis County, we pretty much only have one vendor that does that, which is the domestic violence shelter, which is out of Jefferson County. What's it called?
Victims Assistance Center.
Victims Assistance. They work with Lewis County Opportunities to provide the domestic violence and victims assistance here in Lewis County. So that's where the money will go this year, and probably where it will go in subsequent years, but it's flowing through the Youth Bureau for 2020. Jenny, is that pretty accurate?
It is, the only thing, just remember, Victims Assistance also runs our Child Advocacy Center. So that's kind of
Gotcha.
that partnership there with that team with the Child Advocacy Center.
Thank you. Any further questions? All in favor? Opposed?
And then there is a motion to authorize Public Health Director Ashley Waite to put out an RFP for transportation needs of children receiving preschool special education services due to upcoming contract expiration. This one I do need a motion in a second.
We're required by the state to redo this every 5 years, right?
Andrea, you,
I need the one.
do I have a second?
I'll second.
All in favor? Opposed? Any more business for the Health and Human Services Committee today?